Shannon.
Started.
And Linda, you'll need to unmute yourself.
There we go.
Okay.
So can I got it off this meeting is being recorded?
Yep, go ahead.
Okay. Good afternoon, everybody.
Okay, I'm going to
you want to do your bit? Okay.
Yep. Okay, sorry. Okay, I'm excited to have presenting for us today, Linda Young. Linda comes from us with an extensive knowledge and experience in healthcare leadership and adult education. Linda was director at Michael Garron Hospital through 2 BFI designations, was the former lead of BFI Strategy for Ontario, and is on the BFI Ontario Executive and Board of Directors of the Breastfeeding Committee of Canada. I've had the privilege of working with Linda. She brings passion and years of experience working in maternal child. I hope you are as excited as I am to have her here with us today. Welcome, Linda.
Thank you, Louise. So good afternoon, everybody. The session I am presenting on is, as you see it in front of you, Re-energizing your BFI team, finding opportunities to rejuvenate. The land I am presenting from today is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. I also acknowledge that Toronto is covered by Treaty 13, signed with the Mississaugas of the Credit, and the Williams Treaties, signed with multiple Mississaugas and Chippewa bands. Next. So this presentation was prepared with and in collaboration with input from Louise Guthrow, who you've already met, our co-chair of BFI Ontario, Kathy O'Grady-Venter, who I am sure many of you know, who is an LC and now is the National BCC BFI Project Director, and Yolande Lawson, who is an LC, and she is also a public health nurse and BCC board member. And for the presentation, I've actually borrowed some slides or modified some slides from Kathy Venter and Marianne Brophy and Kathy O'Grady-Venter. You'll notice Kathy's name comes up in 3 different ways in the presentation. I've been true to the way she signed in to different things she's done. Sorry for any confusion. Next. So post-pandemic re-engagement, that's where we're at today. And we need to remember that COVID and your past experience for the last 2 years is a chaotic, unpredictable, and challenging environment. Some days it feels like the tail is wagging the dog. You're worried about where the next crisis is going to come from. You feel like you have so many issues to address to get back on track. You're not sure if you'll ever get there. And you feel helpless on some days to do a good job managing the issues that you are getting from patients, staff, and colleagues. Today, we hope to move you to a point where you can look at your next steps for transitioning to an environment that is actually coming out of chaos, for thinking about ways to restore individual and team balance, and with the understanding that a chaotic environment presents tremendous opportunities for transformative change. So first of all, we want to have a poll, just a quick one. Are you still anchored in COVID mode? Are you still overwhelmed? And you would like to say to me, just go away. Are you starting to thaw and beginning to think about your need to do something about your BFI services? And or are you ready to assess where your practice is at now? And then the second question looks at how soon might you be thinking of BFI best practices and practice changes in your organization. You're now thinking about it, maybe in the summer, likely in the fall, not before 2023. Your plate is quite full. So can you submit your responses, and Louise will share the results with us.
Shannon, can you do that?
Yeah, if there's people, there was people still voting.
Okay.
Okay, I'm going to end the poll now.
Okay. So the results, can you see it there, Linda, or do you want me to?
Yep, I can. Can everybody see them? I guess there's a real range, which I expected and would be quite normal, depending on how impactful COVID has been on your organizational life. And certainly it looks like some people are in the consideration mode and starting to think about BFI. So I hope that you see today as the opportunity to start to reflect, and I'm going to share some thoughts that might help you crystallize your thinking over the next little while. Next. Okay, thanks. So the goals for the session are actually, as I said, a pause for reflection about where are what is the current status of BFI best practices in your organization. It's really important that you just start with where you're at and looking at what approaches you have to reflect on your current state, what strategies you might use to find energy for renewal over the next several months, and what will be your next steps in looking at your organization's BFI journey. So I'm inviting you to think about revive, resurrect, reopen, restart, resume, or engage in a fresh new start, remembering the opportunity for transformative change. Next. So what I want to highlight for you that there have been a number of changes in BFI implementation over the last little while. Louise, I'm going to just change my view and wipe out everybody. So I can't. Okay. I was just trying to figure out how I can get rid of the pictures off my screen so I actually can see my notes. There we go. Okay, so international research has identified a number of important points in the way we frame looking at BFI implementation. First of all, continuous quality improvement is an effective way to implement practice changes. There is a focus on incremental change through best practice implementation. We must have involvement of leaders from all levels. We need frontline care providers and parent partners to be considered valued team members. And we need to have full engagement of the interprofessional team in our best practice implementation. This is from international global research studies across the world in the last 5 to 10 years, and has been a growing momentum that solidifies our thinking on this. Next. So when we're thinking about where we're going and how things have changed in BFI, we note that we've gone from it's all about designation to it's about incremental practice changes. Understanding that the BFI team, as we used to frame it a number of years ago, was nurses and physicians, and nurses including LCs. And this has been expanded to a BFI team that includes all professions, support staff, and parent partners. That data was used as a report card and almost a judgment on us on a continuing basis. Now we use data as key information because we recognize its value for shaping change and monitoring our success. We, for about, I'm going to say more than a decade, there's been a growing focus on population health. But through our research, we now recognize that BFI is also a vehicle to support population health and health equity in Canada. Next. We, within BFI, there has been an increasing focus on shifting the responsibility for success. Just to read this quote, the success or failure of breastfeeding should not be seen solely as the responsibility of the woman. Her ability to breastfeed is very much shaped by the support and the environment in which she lives. There is a broader responsibility of governments and society to support women through policies and programs in the community. So this is an enlarging perspective in terms of the responsibility for breastfeeding success for the woman, her family, and the community. Next. And so with engagement of some key organizations, the Breastfeeding Committee for Canada and the Public Health Agency of Canada, along with Accreditation Canada, have worked on the National Baby Friendly Quality Improvement Collaborative Project. And the work of these three organizations working together is a true example of system building and the actual power of alignment. For a while, you know, each of these groups has been doing different things and waver in their focus and how much BFI is even mentioned in their documents and their visions. But in the last few years, with the funding from the Public Health Agency of Canada, we have an aligned focus and the impact of change. Next. And so Accreditation Canada is known for being the group that helps us look at our practices in organizations and the quality of care through a number of parameters. Part of Accreditation Canada is looking at health standards for organizations, both in the community and the hospital, and weaving BFI through those health standards and having recognition through Accreditation Canada makes it more powerful that we will have support within our organizations and consistency in aligned ability to actually influence quality of care for breastfeeding women. Next. So one of the changes, and there have been a number of changes with a global initiative with the World Health Organization and UNICEF taking some of that research and that I talked about at a few slides ago, and doing a rework of BFI and best BFI implementation and some of the ways to get there. And so one of the things that they did some work on was the 10 steps for successful breastfeeding. And they made a strict distinction between critical management procedures and key clinical practices. And within the critical management procedures, there's a focus both on policy, facility policies and staff competencies. The code of marketing for breast milk substitutes has been included within one of the 10 steps in this way. And although the international standards talk about a breastfeeding policy in Canada and with the BCC's leadership, we've expanded that to have an infant feeding policy, recognizing that there are various ways in which and needs in which breast milk substitutes might be of value and are important. And the staff competency focus helps us to look at and maintain the standards through developing our staff to particular competencies. The key clinical practices are very much as they were before, with maybe slight rewording. However, they are the key focus of the policies and the competencies, and influencing those key practices is our goal. Next. Well, one of the things that has been done is BCC has refined the implementation guidelines and staff competencies documents based on a review of the World Health Organization and the UNICEF new guidance documents at an international level. These can be found on breastfeedingcanada.ca, and if you haven't looked at them recently, it's probably a good idea as part of your process to remind yourself of what's there on the BCC website to help you with your journey. Next. So how do you design your roadmap? What are some of the things you might think about? And these are the areas that I'm going to talk about over the next few slides. Give you some ideas on starting out, give you some ideas on if you're feeling a little bit stuck, how do you find resilience and energy to rebalance? Reminders on what great teams look like, and some tips or reminders of how you might get there, and examples of best practice initiatives. I need to say that much of what I will say to you is probably simply me pulling out different ideas that are somewhere in your mind and somewhere where you've read about or heard about them or even used them, but they're kind of buried in that COVID overwhelmed stuff. And this, I'm hoping, will help you dust them off and get them out of the cupboard so they're in front and center for you. Next. So where do you begin? I'm going to say to you the most important thing over the next few months as you begin this change and revival is listening. Gathering information and thinking about how have things changed in your particular environment. Remember that there are COVID good days and bad days. Just keep asking yourself, how are things different? And remember that if you're asking for stories and recollections, you will have negative energy that people are still carrying as well as good energy. Be curious and open to new ideas. It's an opportunity to learn once again with some focus from patients, staff, and professions, and collectively from those areas and stories, looking for nuggets and insights that give you food for thought and where you might go next. And then the third thing is to be looking at imagining the future. Ask yourself and your staff and your clients, if everything is working, what does care and the patient experience look like? Where would you like the care to be 1 year from now in your area? Where would you like it to be 3 years from now? Next. So I'm going to just refresh your mind or get you thinking about different options for information gathering. First of all, you can start with simply a fireside chat approach. Just ask for some reflections on how we're doing and how people are today in a very general, low-key process that starts to gather some ideas and get people thinking along or in the direction that you want to go. You might do patient rounding, and you don't have to see everybody. Ask a few patients every second day the same question and get a feel for what is their experience now. Ask the patients ask the staff to ask each patient one question and bring the response to a huddle. So and just this is touching base on how we are doing today. So invite your staff to gather some information and hear from their patients, to step back from the moment and what they're kind of focused on, and how is the care going for the patient that we're caring for? What impact are we having? Survey patients and families. Surveys, you can use a BCC BFI survey for patients. You might have your own patient survey. I would say, I'm not saying you have to do the whole survey over again. If you're looking at BFI, you want to have a team focus on BFI, then look at the 3 questions that relate to BFI. Make it, and you can have a much richer focus if you make sure that the questions are aligned to where you want to go. Post-discharge phone calls were a way of gathering great stories and information on care and gathering ideas before COVID, but they may well have gone the way of the dodo bird. I'm not sure if there's any energy or interest in reviving them, but that is another opportunity. Where are you going with this? Well, you're focused on a discovery, so you must be tentative. Your tone should be curious. Don't make assumptions about what you think happened or is happening. Find out from the people who are in the experience. And the task is, as I said before, searching for learnings and insights. Next, Louise. Next.
On there. Did it not move?
Okay, now it is. So re-engaging your team and the search for new energy, I'm calling this. So what you are doing is looking for the long term. Think about energizing everyone every day. Whoever you talk to, if you hear a great nugget, if you have a thought, get back to people. Recognize that positive stories and small successes are really important. You might even have a conversation about everybody, just share one thing you're proud of so that you can put some positive energy into your group at the beginning of a meeting. Communicate what is happening, the direction you're taking, and the next steps. There'll be a lot of uncertainty and ambiguity out there. People will be nervous. So the more they hear from you what's going on, the more comfortable they will be, and the more likely they will be to take risks, to share things with you, and to give you energy for change. Support constructive conflicts, letting people tell their stories and share their concerns, and helping them reframe those stories and learn from the negative aspects is important. Resilience is the most critical fundamental quality for navigating through chaos. So through these suggestions that I have, you're trying to build resiliency as your staff go forward. We need to remember that healing actually comes from telling stories, and enhanced understanding comes from listening to stories. Remember as well that sharing stories takes courage, so thank the people for sharing their stories. Next. So looking at teams, interprofessional teams, and interprofessional education occurs when 2 or more professions learn about, from, and with each other to enable effective collaboration and improve health outcomes. Next. So there are a whole range of both staff and colleagues and partners that you may invite into your BFI team. You may have a large advisory group, and then you may have smaller working groups where key work is done and then filtered back to the larger group for comment and perspective, additional perspectives from their expertise in their roles or their clinical knowledge. Next. So model for improvement. This is the IHI process improvement model, and it's focused on act, plan, plan, act, study, plan, do, study, act, and through that process, you have an organizing structure to your change process for your change. What we find from using process improvement strategies is that we, over time, enhance the members of your team's skill with change and tests of change and their involvement and engagement, and therefore ownership of the outcomes of change. This is a tremendous way of getting structured energy that allows your team to be more successful. Next. So in terms of recovery from COVID, the recovery time offers unprecedented opportunities at all levels to capitalize on improvisations, innovations, collaborations, and lessons learned during chaos to improve performance and care and address inequalities in communities. There are a number of things that may have inadvertently happened while people struggled with COVID and the impact and new ways of doing things. And those things don't discount their relevance or their value without examining them and understanding why people were using them and really exploring their impact. Alignment around a shared purpose and common objectives is essential. That's where you gather small bits of energy into a more powerful, focused energy for change. And communication to maintain clarity and alignment to your shared purpose is extremely important as leaders release some control and establish a high trust among their stakeholders. So re-energizing your team, building resiliency is important. So you must listen deeply, reimagine the future of work, as I've already mentioned, develop adaptability, and support and coach your staff through ambiguity. You need to address disillusion with bounded optimism as an energy, and as bounded optimism and positive energy as a leader. You need to remember that resilient people actually work through issues with other people. They are not solo practitioners, and you need for yourself and for others in your group, if they are self-focused, help to reframe their resiliency and their understanding of resiliency from I can do it all or shoulder it all to I will ask for help when I need it. As we ask for help, we become more vulnerable, but we also share energy. And if we maintain ourselves and our humility, that's when we can discover things we can't see because of our own personal biases. Next. So engagement is extremely important to energy. And the reason why you seek to engage people is because you're trying to capitalize on the emotional state of it, where people are passionate and committed to their work. That in itself has a whole energy behind it. And so ongoing communication, we know, is essential to staff engagement, and you can build staff engagement through powerful connections and communication. Remember, in terms of communication, all ideas are welcome. Make sure you have safe spaces for suggestions and negative observations, that you coach people on respectful sharing and understanding of stories. One of the things that I've used many times in my career is the direction or a ground rule that says listen and suspend judgment. You never know what you might learn if you're really listening. And reinforcing that all contributions matter, negative, positive, indifferent. Next. So if you reflect back on the interprofessional team, Just a few things that I've already highlighted or with some additional thoughts. If you organize your thinking in terms of who, I want to suggest that based on the shifts that we've seen with the research and baby friendly, the job might be different now for your team. You might want to refine your team themselves. You may want to reflect on those shifts in the way BFI is being viewed and shift global thinking. You want to assess whether you need a new team with new energy and a positive perspective and a can-do attitude among them. And you need to consider seriously adding parent partners to your team. You need to think about setting the tone for input from all, roundtable sharing, what they might bring to discussion, inviting knowledge experience to the table, and ensure and recognize that high-performing teams use a shared vision and they respect ground rules. Why are you going in this direction? Because we know that you will have a much better fit with change and a more sustainable change if all of your team members have commitment to your plan and they understand it and have held it and believe in that plan. And through that process, you'll support seamless continuity within and beyond the organization. Next. So this is something that I've created from a book I read called Organizing Genius, The Secrets of Creative Collaboration by Bennis and Ward Biederman. And it was about a research study with a number of globally renowned teams. One of the teams, for example, was the team that built the atomic bomb. So they interviewed everyone on the team who was available and then wrote a whole story about each team and then brought together some collective thoughts. So my reading of that suggests that great groups are coordinated teams of original thinkers who value and make the best of each individual's genius. They have fun displaying an almost adolescent subculture. They have great teamwork. They think that creating the future is really neat. They engage in a process of discovery and that has its own rewards, and they build on collective creativity and collegiality. In these groups, the leader and the team create something together that neither could create alone. And dissent is encouraged because it serves the spirit of discovery that is at the heart of a new enterprise. And I would invite you to think about how you might use this. I actually use this on one of the Child Health Network committees that I was on, I was a co-lead for, and started the first meeting with this. And I really believe it set the tone for a fabulous team experience. So I have no problem if you copy it and create, build your own story off it, but it becomes that shared focus of how you might shift and build a stronger team that you haven't had before. Next. So we thought we would give you a brainstorming of a number of ideas that people across the province have used around BFI through and using CQI strategies to try and improve their practices. So safe skin to skin positioning, lots of ideas from the crib card, and your pictures here are reminders from the crib card. Supplementation and what are the best practices and what are your concerns. Infant comfort measures during painful procedures, hand expressions, cesarean section, skin to skin experiences, antenatal teaching, informed decision-making, infant feeding, baby cues, and maternal self-care. What you're trying to do, going back to the stories and collecting stories, is you're trying to unbundle ideas, make some meaning from the stories that you're hearing in the context of your organization and what's important to your staff and your community. exploring the contributing factors to those stories, and through thoughtful reflection, guiding reframing of where you're at now to where you might want to go next. So what I'd like to say is really, I've tried to give you a range of ideas and considerations for your reflections going forward. We will put this presentation and a number of resources that Louise has worked on, a few slides, on our BFI Ontario website. And I'm just wondering, do we have time for questions, or did I talk too long, Louise?
I think if we have maybe one or two, we do have to get on with our meeting, but I think that we probably, is there any questions that have come in, Shannon, through the chat?
Or
Not as
any
of yet.
comments?
Or any
No,
comments?
no comments, no questions.
Okay. Well, we'll see if potentially maybe after our meeting, if maybe people have some other questions or thoughts that we can address them then. So please feel free again to put any questions in the chat and we can put it there. Okay, go ahead. It's all right. Go ahead, Linda.
Okay, so we felt that the next steps, we have a fabulous opportunity right now from BFI or BCC regarding BFI, and they have a coach mentor program that they have started. It's part of the funding in the collaborative project. And we have invited Kathy to speak next Thursday from 12 to 1, and would suggest to you, if you want to look and see if you can access a free BCC BFI coach for your team, this might be a great session for you to come to, or refer some other people in your organization to listen to, and get some questions answered. The project winds up at the end of December. So it's an opportunity, if you get started soon, to have someone actually helping you along your journey with your next steps with BFI.
Okay. Thank you so much, Linda, for your wonderful presentation.
Just a couple of comments.
Okay.
From El Mino, thanks much for the invite for the session. Enjoyed. Laura says, thanks, Linda. Very interesting thoughts to get us started. Emily said, thanks. And Shanaz said, thank you. Very informative presentation. Sonia, thanks, Linda. Amy, thank you for this presentation. Could you provide specific education, self-directed learning opportunities? We have used the BFI strategy for Ontario education and BFI 20-hour course in the past. So that's one question.
Okay, so maybe we'll just address them after the recording stops here. So if you're able to stop the recording, Shannon,